PMD, what do we do? We want to start by asking a question. If we had 12 hours notice of a patient's deterioration, what could we do? Could we have less clinical events, deliver more timely, less invasive interventions? I want to share 3 key messages that I'd like to gain from giving you these advantages. Creating the awareness around respiratory rate being the single most earliest indicator of patient deterioration. Hospitals' quality of measurements of respiratory rate currently is very poor, and how continuous monitoring of respiratory rate can not only improve outcomes and free up costs, but also free up costs for the NHS. So why is it important? Well, respiratory rate is the earliest and most sensitive indicator of a patient's deterioration. 21% of general ward patients with a breathing rate of between 25 and 29 breaths per minute will die in hospital, and the identification of this can be up to 24 hours in advance with a specificity of 95%. Changes in respiratory rate are greater than changes in any other area, i.e. heart rate or systolic blood pressure. Yet it's the one vital sign that hospitals still monitor inaccurately. So over the last 170 years, we've continued to observe patients breathing. And this graph here from 1846 shows that we have these 4 peaks within respiratory rate monitoring, 16, 18, 20, 24. We move forward 170 years and we do a study of 39,000 patients in 2017, and we still have these 4 peaks, slightly different, 16, 18, 21 and 24. We compare that with heart rate, and we can see we've got a natural distribution curve there of this information, which tells us that nurses are picking their favourite numbers when they're doing their EWS scores and when they're monitoring these patients. So what we need now is an objective way of monitoring respiratory rate, so we can remove that bias so that we can improve outcomes based on this data. This has been PMD's mission for the last 6 years. So RespiraSense, I think I have one here. There we go. Is the world's only continuous motion tolerant respiratory rate monitor. Clinical studies have demonstrated its reliability in measuring respiratory rate, while also demonstrating its ability to deliver meaningful clinical triggers for ensuring early identification of patient deterioration. RespiraSense is not only the world's first continuous respiratory rate monitor, but we've identified that it can have up to 12 hours earlier warning of a patient deterioration compared to the current standard of care. It's fully interoperable with your electronic health records, so I know Bradford and Calderdale recently have implemented Cerner. We can implement it with Cerner, and specifically designed for the general ward patients. It's got low false alarm rates, which takes away that alarm fatigue, and it's been evaluated on over 1,000 patients, and it's fully CE marked. So if any of you are wanting to adopt some innovative technology that can have impact on and improve patient outcomes, then please come and see me on one of the stands outside, or you can download our ebook for some information on how we improve escalations and pneumonia from pneumonia and sepsis patients.